Kia ora whānau, ko Tongariro te maunga, ko Taupo te awa, I noho au ki Morrinsville, I whānau au ki Sweetman, ko Richard toku tānei, ko Lucy me Alice oku tamariki, ko Hayley aho. So, hello everyone, my name's Hayley. I am one of the GP owners at House Te Aroha, and today, I must admit, I feel a bit like a proud mother because we were one of the first GP practices that was privately owned to do the Health Care Home journey, and that was in 2012. And to listen to all these talks that you guys have done today, and to think that we had something, we started ages ago. It took us absolutely ages. It was really hard. And to see that you guys have done it so much quicker and in some ways so much better than what we did, it's like really awesome. So I wish my whole team could be here so that they could see what all their pain has brought about. But yeah, we'll be telling them tonight when they come to the dinner. So we're here to talk about matching the workforce to the demand, and because I'm so short, I can hardly see the thing over the thing, so if I'm tiptoeing, that's why. And we're going to tell a story about a Mickey Mouse practice. So I hope I'm not going to get in trouble with Disneyland here, but so we're going to talk about a practice called Disneyland Health that has 4 doctors. So we've got Mickey Mouse, Sleeping Beauty, Donald Duck, and Scrooge McDuck are the 4 doctors that work at the practice. And this is what they normally do. They all have exactly the same template. They rock up in the morning, they get all their appointments booked. They have 4 doctors, each doctor has 4 acute slots, and that's 16 patients that can rock in and get those appointments. The rest are all just booked, okay? So what happens when people go away? Well, in this practice, Mickey and Scrooge have gone on holiday, and they've left Donald and Sleeping Beauty at the practice. And as you can see, we've still got the same exact 2 templates that they always have every day, because they don't change anything and they don't look at their demand. They just have the same templates every day. So that leaves 2 doctors with 4 acute appointments each. So that's 8 acute appointments. So now we have 2 doctors away, so we're 2 doctors down and we've got 8 acute appointments. And this may ring bells for people in practices who do this. We tend not to do this very well in general practice. Or what happens during the flu season? We've still got all 4 of our doctors there, but we've still got 4 acute slots each, so 16 total spare appointments. So while that's usually what we do every day, when you think about it like that, it is a bit dumb. Because when people are away, this is what happens. Sleeping Beauty gets really tired, and she falls asleep because she's double booked, and all her appointments are yellow if you're still using MedTech. Donald Duck is going, I have had it with this. I am so sick of Sleeping Beauty. She goes to sleep all the time. And Mickey Mouse goes away, and Scrooge McDuck goes away, and I'm left here holding the fort. And meanwhile, they go, right, we need to get a locum. And so Scrooge McDuck goes, but wait a second, I don't want to pay for a locum. You guys went away last week and I dealt with your overflow, so why can't you deal with mine? So then we get the poor practice manager involved. and we say to him, we really need you to sort this out. And so along comes Dwayne.
So I'm actually going to digress a little before I continue on, and I'm going to tell you a little story. And the reason I'm going to tell a story is threefold. 1, my slides are data. I don't want you going to sleep. 2, I only have 4 slides. Andrew used 1 of them this morning, so I'm down to 3. And 3, position is 9/10 of the law. Now, I'll explain that soon. So, my story. And there's a key phrase at the start of the story. I have the absolute pleasure of. I have the absolute pleasure of living with my mother-in-law. This is a true story. I have the absolute pleasure of living with my mother-in-law. I was at the work do last year. I've got a couple of little girls, bit of background, I live rurally, got some sheds, some land. Hayley's kids were driving around in a little motorised car. That looked really cool. My girls like the look of that. Hayley said, do you want that? Absolutely, yes, I'll have that. I'll get Richard. Richard's Hayley's husband. He can drop it around on Tuesday, so this is the weekend. Richard, to put a bit of background, roughly the same size as me, same shape, same height. I wouldn't say we look too similar, same haircut. The week before, I have the absolute pleasure of living with my mother-in-law, was beep, 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 my mother-in-law, which means we were not communicating. So I did not tell her that Richard would be dropping around said motorised car. So Tuesday at work, Hayley's away for the week. Get a phone call from the wife. Mum's just rung. There's someone in your shed. He's come out. Mum's run downstairs, gone outside. As soon as he's seen her, he's taken off. I was like, it's all right. Just be Richard. I said to Hayley, go into the shed with the roller door, put the car behind the tractor, and I'll grab it when I get home. I don't want the girls to see it. No problem, get home. Go and look in the shed. No car. Look through the other sheds. No car. Looked in the hay barn, no car. It's like, ooh. The description earlier from the wife, tall man, thin build. Jumped in his car as soon as he saw me. So I went and saw the mother-in-law. What did he look like? Short, stocky guy. Richard drives a people mover. What car was he in? Oh, he was in a sedan, like my wife's. I was like, okay, so this is not good. Definitely not Richard. Went and saw the neighbours. There's been thieves. Be very, very careful of what you've got out. Looked into security measures. As I say, I live 200 metres off the road. You can't see my neighbours, so you're always worried about security. So definitely not Richard. Looked into all sorts of security stuff. Told all my neighbours what's going on. So Hayley comes to work on Friday. Did you get the car? It's like, car? No. It's no car. Rings Richard. Yep, I dropped it off on Tuesday. Whereabouts? It's in the hay shed. Went home. Here it was, behind 3 hay bales, and he put a sheet over the top of it. Now the reason I talk about this is perception. Perception and communication is key to anything. And I'm going to include perception when we're talking about demand, because it's key to give data to your staff, to the doctors, to be able to sell any change you want to make. So basically we had a meeting, how we're going to manage our demand or how we're going to measure it. We do phone triage. So the decision was made that we would look at a temperature or how we're going to measure demand by going off our phone triage on a daily basis and then working that into the doctor's appointments. So that seems easy. As I say, I actually don't come from a medical background. I'll be able to push a couple of buttons, spit out a report. Let's get started. So our previous PMS did not allow that. So this picture's me. Could not be worse because I had to start counting. So what we did, basically we looked at phone triage every day for a year, and we graphed it into monthly demand, and we also graphed it into daily demand, and then we averaged those numbers. I'm not sure if you can read that very well, but basically we then got a pattern per month and per day. Now the green one is last year, the blue one is the year before. So originally when Andrew's put the slide on the board this morning, we've just had the blue one up there, and it gives us an average amount of people that are ringing into the practice on a daily basis or on a monthly basis in terms of this graph. and you can see there's peaks and troughs, but it's relatively consistent through winter and then through the summer months. We also graphed it to the day of the week, just so that we could then match monthly demand versus daily demand and come up with a plan on how we're going to put in acute slots. On top of that, obviously it's only phone triage, so when we're doing phone triage, we're not bringing everybody in. When we originally did it, we worked on the fact that we would approximately bring in 70% of people into the practice if they were on the phone triage list. July 2019 snapshot, and this wasn't planned, I just pulled it, 69% of people came in same day, face to face with a doctor. So, what are we going to do with the data? June to September, we averaged 30 phone triages a day. So if we apply our daily curve to that, so that we averaged the 30 across the week, it was 44 on a Monday, 29, 28, 27, 26. So if we utilise 70% of people coming in, that's how we come up with 31, 20, 20, 19, 18 in terms of acute slots each day. So we're managing demand by looking at historical data. We're managing demand daily by monitoring what's going on, but by having the appropriate amount of slots acutely across all docs. So in the past, as Hayley's put up there, if we've had 4 docs on and they each had 6 acute slots, that would be 24. On another day, we'd have 6 per doctor, but there might be 2 docs. Now we do it across the board. So you've got 30 whether there's 2 docs or whether there's 6 docs. And the benefit to that is that we're managing our staff's workload. We've monitored double booked appointments and spare appointments for 6 months, and basically doing this, it averaged out 1 to 1.5 of each. So anyone can look at a demand for the year. We want to be able to manage that acute demand across any given month or day.
So once the Disneyland Health team have done that, and they've decided that 16 appointments is appropriate, but when they have 2 doctors away, what they're going to do is actually increase the use on the day slots to 8 for each doctor, still mixed in with their face-to-faces if they want to, so that now Donald Duck's not going to get grumpy, and Sleeping Beauty is not going to fall asleep, and we're going to have a happier practice, and all the patients are going to get dealt with appropriately. So there's happy Scrooge, there's happy Donald, Sleeping Beauty's awake, Eeyore is happy, and the patients, who just happen to be my beautiful children, not that I'm biased, are happy because they get to see their doctor. And there's no, and I think that's the other important thing, is that there's somebody said before, the Maori proverb that is, he tangata, he tangata, he tangata. This model really is about the people, and it's about the patients having an experience that is good. So if our patients ring up on the same day and need an appointment after they've been phone triaged, there are appointments there for them to have. But equally, I'm not double booked. They're getting better care because I'm in a much better space, and my staff are much happier, and they have time to do their paperwork, and they have time to actually be human beings. So Tertius, who is one of our doctors, he's now 71 this year, he was. He doesn't mind me telling you that, I have checked. He often says that he would not be working now if it wasn't for the way that we work, because we see 20 patients a day, whereas before we used to see upwards of 29, 30, and we were 120% booked. So this has really, we are in a rural practice, we can't just send them down the road to the after hours. So this has really changed our practice, and it's meant that we have not had locums, we've not had to pay for a locum in the last probably 4 or 5 years. Brendan had 6 months off last year as a sabbatical, and for a year I only worked 2 days a week, and I spent time with my beautiful children. As you can see, we went and visited their Dr. Mickey. And yeah, so we're not burnt out. Our patients therefore get better care, and everyone's happy. So we think this is a really important part, and happy to share any tips, tricks, anything like that. But yeah, be like a Disneyland practice. Be a Mickey Mouse practice. That's us.